and so beautiful, so graceful. Thank you so much. Ladies and gentlemen, any guesses about this, the age of this young lady? I can only think of one saying, an ageless mind, timeless body. Dr. Dadij, may I reveal your age?
71. Maybe Ulta. You can put it Ulta.
With that grand introduction to Guruji from NASA to Vyasa, and with a equally spectacular introduction to the art of yoga, I will quickly move on to introducing our chief guest for the day. We have with us a multifaceted personality, Mrs. Kavita Khanna. Thank you for being here. She's done her graduation from London School of Economics, and she holds a master's diploma in law and practice from City University, London. After practicing law for a few years, after holding several important roles in the corporate sector, Kavita is today a health activist. She has worked for the cause of eradication of Kala Azar, or the sandfly disease, which affects the poorest of the poor in India. Kavita is also on the national executive of the BJP, which is the apex policy-making body of the party. She's also the director of the International Association for Human Values, and of which the World Alliance for Youth Empowerment is a part. I would like you to shed some light on this last role that you've taken on recently as the director of the International Association for Human Values. That would be good for us. Guruji, there is one issue that I would like to bring to your notice. A steering committee of the Health Ministry a few years ago brought up a report which says that with 17% of the global population, India accounts for 20% of the global disease burden. The mortality figures for communicable disease is a very high sum. It comes to about 2.5 million child deaths and an equal 2.5 million adult deaths. And when I say communicable disease, these are TB, malaria, leprosy, which can be easily treated at the early stages. Our public health expenditure is 220 rupees per capita. Today, India also straddles the health risks of the very rich and the very poor. So your diabetes program is part of that. But I would also like to say that as a result of the financial burden of health, we have 2% of our population falling below the poverty line every year because the government does so little. And the cost of hospitalization is almost catastrophic. 50%, this is all as per the Government of India Steering Committee report of 2008. Almost 50% a person spends of his annual income on hospitalization alone. So the health costs are staggering. In such a scenario, a technique like yoga, which is completely drug-free and which is so cost-effective, why can't it be made a study from KG right to the postgraduate level? I know your organization, the Swami Vivekananda Samsthana, is doing research in these matters, but why can't it be introduced at a wider level in the curriculum from KG upwards. That is one thing that should be done. So I hope you will tell us something more about this. Thank you very much.
I bring greetings to all of you from Prashanti Kutiram, the residential headquarters of Swami Vivekananda Yoga Anusandhana Samsthan, a very unique yoga university. It's very interesting to hear the nice comments made by her. And we have been working in this field for the last 35 years. And we have brought yoga into the field of education in a very big way, and we have trained about 50,000 yoga teachers, and we continue to do that. In this year we trained about 1,000 teachers to go into the various yoga schools, and we have developed a very unique syllabus for the children. It is not just you teach some asanas or some pranayama or meditation to the school, but the real purpose of yoga is to build the total personality. For that, we have developed different modules: eyesight improvement, voice culture, hearing development, memory development, IQ development, creativity development, team spirit development, physical stamina development, like the totally 10 different modules from class 1 to class 10. It is this that we train the teachers to introduce these dimensions into the school. And we have done a lot of research over the last 25 years to show how it's very effective, how the memory can increase in just about 10 days from 23% increase in the audio memory, 20% in the visual memory, then 18% audio-visual memory, and 13% in short-range memory, 9% in long-range memory. Like that, all these things have been researched and worked on. Therefore, the government is very keen, and then we are training continuously the teachers. So what you said is absolutely right. It's very, very cost effective, and we should bring it to the whole thing. But what we have also been urging the government is to introduce that at the B.Ed level. So all teachers will be trained to bring in this dimension so that it will go automatically into the whole system. Karnataka started in 1991, and there we have trained about 4,000 teachers. Okay. Health. Many times we think that if you don't have a disease, we are healthy. But look at the definition of health by the World Health Organization. It says it is not mere absence of an illness or infirmity, but it's a state of well-being. Well-being at the physical, mental, emotional, and spiritual levels. If I plot this, what I call as the health line, we also have the concept of health according to Ayurveda. It says sama dosha, sama dhatu, sama agni, and prasanna atma indriya manaha. That is a very important thing that brings us towards today's topic, health and happiness. Something here missing. Something is missed out here. Here we have the state of health, also the state of well-being. As our well-being goes on improving, the state of health also will increase. Well-being at the physical level, mental level, emotional and spiritual level. This is the region of normal health. The whole purpose of any healthcare delivery system should be to essentially prevent us from going down into the region of illnesses, prevent diseases, and to move towards positive health and perfect health. But when you look at the budget that we allot in the health scenario, how much do we spend for prevention and to promote positive health? Hardly 1%. So how can we expect that people will remain healthy and start moving towards positive health? This is our tragedy in the country.